So good afternoon, everyone, and welcome to Partners Member Cafe. We're going to give it just a few moments so all of our attendees can get logged in before we get started. I hope y'all are enjoying the beautiful sunshine we are having here at least in the Charlotte area of North Carolina. All right, so it looks like our attendees have leveled off. Few more popping in. My name is Ann Gluff, and I am part of the member engagement team here at Partners Health Management. So glad that you're spending your time here with us today. So we have a lot of great information for you today. We do have a guest speaker, possibly two. We're hoping another is going to join us from vocational rehab, and I'm going to introduce them in just a moment. And right now, let me share with you who is with us today on the panel. So Beth Brooks, if Beth, you want to just give a wave. Beth is our Zoom guru, and she is making sure everything is happening right behind the scenes, and she's going to moderate our questions for us when the time comes. Terry Christie is also part of our member engagement team and provides absolutely wonderful support. And Stacy Lawrence, she is one of our member engagement specialists. You may have talked to her on the phone. She is going to enter some great info into the chat for you so you can grab it and copy and paste it very easily. Allison Crotty is our senior director over member services, and she's joined us here today. And then also Regina Haynes. She is a program manager over our Healthy Opportunities program. So let me give you just a few housekeeping notes before we let Regina share some information with you. So I want to let you know that this session is being recorded. So please be mindful, when we get to that question and answer time, to not share personal information. We are very happy to meet with you one-on-one. You can give us a call, shoot us an email to set up some time, or just give us a call in member engagement. So it is being recorded. I think I said that already. And then the other thing I wanted to let you know is this is being offered in closed caption. So if you don't need the captions, you can simply click on captions at the bottom of your screen and you can turn that off. And what else am I missing here? Q&A. So when our presenters are speaking, anytime you think of a question, I want to encourage you to enter your question into the Q&A. So right next to the chat bubble, you'll see a double bubble for Q&A. So you can enter your questions there. And when our presenters are done, we're going to take all your questions at that time. All right. So right now, I would like to hand it over to Regina Haynes. She is, again, the program manager for a program called Healthy Opportunities. And she's going to share a little bit of information about that before we go into our main guest speakers. So take it away, Regina.
Thank you, Ann. I was muted. Are you going to share the flyer or do you want me to share it?
Beth's going to share that for you.
Okay.
Hang tight just a second.
Thanks. Thank you, Beth. Hi, everyone. My name is Regina Haynes. I'm the program manager for our Healthy Opportunities pilot program, which actually kicks off on May 1st. We're really, really excited about all the services that this program is going to provide for our members. It is on May 1st. It's only going to be initially in the Burke and Rutherford County areas for members that live in those two counties. That is for May 1st. We are hopeful that it will expand into more counties later in the year. We're still waiting to hear about that. But some of the services that this program provides is it provides food, healthy food boxes delivered to people's homes. It provides, or for pickup, we can provide transportation so that members can engage in the community outside of going to their doctor's office. Things like going to the grocery store, going to things that are about your wellness, about members' wellness. Then we have housing programs that can help people get into housing, pay for some of their initial setup for housing. The housing program also can help do remediation on homes. If you own your home and you need remediation for health reasons, there's some services that will help address that. And then we also have services that help people who are experiencing interpersonal violence or have a history of having experienced interpersonal violence. So we're really happy about this program and what it's going to bring to our members, initially, at least in the Burke and Rutherford area, and hopefully soon in other counties as well. So thank you for letting me speak today.
All right. Thank you, Regina, for sharing that information. Appreciate that. And just to reiterate, the pilot program that Regina was talking about is Healthy Opportunities. And it is during the pilot time, it is available in our catchment area only in Burke County and Rutherford County. And it is, you do need to have Medicaid to access this program. So any questions you might have, I encourage you to put those into the Q&A.
And if it's okay, is it all right if I put our email address?
Oh, please do.
Okay. Then if anyone has
do.
any questions, they can email us directly. I'll
Right.
put that in the chat.
Wonderful. You can put that in the chat.
For question chat.
Put it in the chat. Put it in the
Thank
chat.
you.
So our attendees, you all cannot access chat. It's turned off for you. But we can chat out to you. So any of your questions, just pop them into the Q&A. And when we're done with our session today, we will have some time for a Q&A at that time to answer those questions. I see our second presenter has joined us. So now what I'm going to do is introduce our presenters. So Beth is going to be pulling up the slide deck for us while we're doing that. So first we have Lisa Oakley. Lisa's been with the Department of the state of North Carolina for 30 plus years. And so she is an absolute subject matter expert on working and keeping your benefits. And then also another subject matter expert, we have Jacqueline Moore is here with us today. And she is a community work incentive coordinator with the North Carolina Department of Vocational Rehab. And she works in the Statesville office. She is a native of Ohio. That is something Jacqueline and I have in common. I too am a native of Ohio. So really? Small world, right? Yeah. Anyway, I don't want to waste our time talking about that. What I would like to do is get that great information up on the screen so Jacqueline and Lisa can share their expertise with you. And as they talk, please feel free to put your questions in the Q&A so we can address those when they are done sharing their information. So I'm going to let you all take it away.
Okay. Well, good afternoon, everyone. As stated, I'm Jacqueline Moore, and I am with the WIPA program, which stands for Work Incentives Planning and Assistance, a program that is funded by the Social Security Administration, but we are housed in vocational rehab offices. And today we're going to talk about promoting employment for persons with disabilities. Next. So the good news is that all beneficiaries who are receiving Social Security disability benefits of some type are afforded a free benefits consultation. We will also see individuals who have started work who may have a new goal where they want to increase hours or change a job or add a job to what they're doing so they can get a benefits analysis whenever there's a change like that. The best time to refer an individual for benefits consultations is when before work is the best case scenario so that they will have all those work incentives available to them, but it doesn't always work out like that. So the sooner the better. Next slide, please. So the question is, can a beneficiary keep work and keep their benefits? And that's a yes, definitely, because Social Security has special rules and work incentives to help that individual kind of transform into the workforce without everything falling apart. So they have a lot of protections there in place for them and also maintaining health care. Next. So we're going to jump right into SSI, which is Supplemental Security Income. SSI is not a benefit, it is a supplement, and it is normally given to a person who is born with a disability or who acquires a disability prior to getting enough work credits into the Social Security Trust. They have not worked long enough to be an insured worker. This program is for the aged, blind, and disabled that have little or no income, and it is for food and shelter. And it is provided Medicaid also. So when a person's on SSI, they will get Medicaid also. Next slide, please. So these are the what they call the federal benefit rate. The federal benefit rate is the amount of SSI that is established by Congress. For 2024, an individual on SSI would be receiving $943 per month. If we have a SSI couple, both on SSI, the max benefit for this year is $1,415. If we have an individual who is living in a home or living in someone's home, but they're not paying their fair share of living expenses to live there, then Social Security will reduce that SSI, individual SSI, by 1/3. So they would be receiving $629. And let's see here. Unearned income and earned income from work, living arrangements, and marital status are the things that can affect the amount of a person's SSI check. Next screen, please. Also, since SSI is not a benefit, it's a supplement, it does have a resource limit. So that resource limit for an individual is $2,000, meaning that person cannot have more than $2,000 checking, savings, IRAs, stocks, bonds, anything basically that can be converted into cash. And for a couple, eligible couple, that resource limit is $3,000. So with Social Security, like I said earlier, they have established work incentives to help a person ease their way into work so that they don't lose everything so quickly. Some of the work incentives under the SSI program are 1619B, the impairment related work expenses or IRWES, blind work expenses, BWEs, and the student earned income exclusion, which we'll talk about more. So how is SSI affected by working? Social Security, when a person works, the first thing is that I always tell people, if you don't remember anything else I share with you, the most important thing you have to do, or your payee or guardian, must report the income to Social Security on a timely basis. That is on a monthly basis, and Social Security should receive copies of pay stubs, or whether you do it through their phone system, they need to receive that information by the 5th of the following month, so that they can calculate the correct amount of SSI to send that individual 2 months later. SSI pays on what they call a retrospective payment. So there is always a 2-month delay from the time a person earns money from working until the time you'll see the change in the SSI check. Social Security's rules say that they will not count the first $85 per month that an individual earns. After that $85, SSI will be reduced $1 for every $2 the client earns. So we have an example here of an individual earning $10 an hour, working about 25 hours a week. That would make their average gross monthly income about $1,082.50. So that's what Social Security would be looking at. Social Security would take that amount on the second line there, and they would not count the first $85, bringing the income down to $997.50. Then they will start reducing the SSI $1 for every $2. So they will divide that number by 2 for that purpose. So the individual's countable income in this scenario is $498.75. So although they earned $1,082.50, Social Security does not penalize dollar for dollar. The countable income is $498.75. What the next step of the calculation is Social Security will subtract that countable income from the usual SSI check of $943 for an individual. That will make this individual's adjusted SSI check 2 months later $444.25. So people always talk about, I go to work, my SSI goes down. That's the way the program's designed to work, because remember, it's a supplement, not a benefit. So what I tell people is we have to look at the bigger picture. So we have to look at the new SSI, the adjusted SSI of $444.25, plus the earnings of $1,082.50. This individual now has $1,526.75 per month to live on, as opposed to $943. Okay. There are two of the work incentives in this calculation is the $20 general income exclusion plus the $65 earned income exclusion. That's what makes up the $85 that they take off the top. There is a break-even point, the dollar amount at which the SSI would break even. That amount for this year is $1,971 of earnings per month, would zero out the person's SSI check, but they have $1,971 to live on, as opposed to $943. And we will talk about them maintaining their Medicaid also with that. And remembering Social Security always goes by the gross and not the net. Next screen, please. So 1619B provision, this is a work incentive to protect an individual's Medicaid. So in that scenario where I said the individual could zero out the check, they would still be eligible to keep their Medicaid through 1619B. And 1619B rules says that as long as they continue to have a disabling condition, they need Medicaid in order to work, and they've used Medicaid at least one time in the previous 12 months, they can keep their Medicaid until their annual salary reaches $43,307 for this year. So a person on SSI has huge earning potential if that is the goal for their life. Okay. Next screen, please. So I stepped ahead a little bit. This just states the 1619B threshold of $43,307. And an individual threshold if a person's medical cost or their Medicaid needs are higher than 43,307. A Medicaid can do an individualized threshold where it can increase that threshold amount for the individual. Next screen, thank you. Another work incentive that can help reduce a person's countable income is called the impairment related work expenses. And these are expenses that are paid out by the client for things that are related to their disability and they need that item or service in order to work. Examples of that would be work-related equipment or modifications on a vehicle, employment services, approved transportation for work. Medications could be a part of impairment-related work expenses. So those help reduce the person's countable income. Next screen, please. So I'm sorry, I'm going to go back and say with the impairment related work expenses, Social Security will approve, if they approve those expenses, when they calculate the person's income. Let's say Jimmy had $200 worth of transportation, medical costs that Social Security approved. So when they do his calculation of earnings, they will give him half of whatever he spent on those approved impairment related work expenses. So that would make his adjusted SSI check $100 higher because of those impairment related work expenses. Blind work expenses work the same way for an individual whose diagnosis is based on blindness. They can take a lot of work, a lot of expenses off their gross income to determine what their countable income is. Some of the examples of blind work expenses would be meals that the client eats at work, transportation costs to and from work, union dues if they had any, or licenses, work tools, uniforms. Another thing that an individual who is blind can write or can take off of their gross income are their state, local, federal taxes. All those things can fall under the blind work expenses, helping to reduce that countable income and keep more of their income in their pocket. Next, please. Next, we're going to talk about the student earned income exclusion. This is a wonderful work incentive for an individual under the age of 22 who is regularly attending school. If they're working while attending school, the very first work incentive that Social Security is going to look at when they report wages, they have to establish that they're a student. So Social Security knows to use this exclusion for them. But this is the first one they would use. And it says that the person can exclude earnings up to $2,290 per month for a maximum annual amount of $9,230. And they may utilize this work incentive along with the IRWIs and or blind work expenses. But this work incentive, most people, it's going to wipe out their earnings right away, and they will still have a full SSI check because they excluded that $2,290 of income per month. So that's a wonderful work incentive that can be used while an individual is in school. Next slide, please. So this last work incentive that goes along with SSI and working is called a plan to achieve self-support, or a PASS plan. A PASS plan is a formal written agreement where the person is establishing a work goal that they need to pay for or fund. Say they wanted to go back to college, but they needed funds to go back to college. what they can do is set aside some of their earnings from work. Let's say they set aside $300 a month in a PASS plan. A PASS plan is simply a savings account that's earmarked specifically for this individual's vocational goal. And what it will allow them to do is put the $300 aside in a pass. That $300 or that pass account cannot be looked at as a resource for SSI resource limits or Medicaid resource limits. So it wouldn't count as a resource, but it would allow this individual to pay for their goal. And the hope is that when they finish the PASS plan or the schooling, whatever the vocational goal is, they will become more self-sufficient and come off the rolls of SSI. So in that scenario of the individual putting 300 away, SSI would increase the person's check by 300. So they will give the person dollar for dollar back the amount that they're saving per month toward their PASS account. Okay, so that's another wonderful work incentive. It has to be a feasible occupational goal. It's wonderful if vocational rehab, supports that goal. If they're a voc rehab client, it has to have a definable time frame. And of course, the biggest thing is resources must be set aside, but you have to use those resources for what you said you're going to use them for. Otherwise, you'll end up having to pay that money back to Social Security. So it's a good idea to have that money set aside where it's not commingled with the other money that you have budgeted for other things for the month. And that it takes the form number for that pass is SSA 545. So now we're going to move and change our hats over to the SSDI program, Social Security Disability Insurance. This is an insurance for an individual who has worked and paid enough into the Social Security Trust, and they are receiving SSDI based off what they have paid into the system. This benefit comes with Medicare after 24 months of being on SSDI. Next. So the work incentives that go along with SSDI, the first phase of returning to work for an individual on SSI, if they've not worked before, is called a trial work period. And the trial work period allows a person to earn any amount of money and keep their SSDI check. The trial work period lasts for 9 months. Those 9 months are not necessarily in a row. For this year, a trial work period is noted by any month. The gross monthly income is at $1,110 or higher. That's what counts as a trial work period. And once a person has accumulated 9 of those trial work periods within a 60-month period of time, that is when your trial work period will end. Okay, let's move on. This is just a visual of a person working, and every month that there's a star, that's when they went over the Medicaid. I'm sorry, that's when they went over the trial work period level. So they've used up the 9 months. And as you can see, they're making really good money those months, 5,000, 2,000. So the person can earn any amount and keep the SSDI during this time until he or she completes that 9th trial work period within a 60-month period of time. Okay, we can move on. So there is, after the trial work period, Social Security gives an individual what's called an extended period of eligibility. The extended period of eligibility lasts for 36 consecutive months. That is when Social Security starts comparing the gross monthly income that the client brings in to what they call the substantial gainful activity rule, or SGA. And the SGA for this year for an individual who is not visually impaired is $1,550. For an individual whose primary disability is based on blindness, their SGA level is $2,590. So pretty much what this means is any month the person's gross monthly income are under these levels, they would continue to be eligible for their SSDI that following month. Any month they hit or exceed this amount, they would not be eligible for their SSDI. So during that extended period of eligibility, their payment status, they could go in and out of payment status based on what they're reporting to Social Security each month. Okay, next slide. So with the SSDI, there is extended Medicare. Medicare can be extended at least 93 months. That's a little better than 7 years. That 93 month clock starts right after the 9th trial work period month. And some individuals may be able to extend it even longer than the 93 months. They would just have to follow up with Social Security to see. It's kind of like extending the Medicaid threshold. It's possible on an individualized basis that it could be extended even further. Next slide. So we do have a work incentive. This is a Medicaid work incentive called Health Coverage for Workers with Disabilities, which is a category of Medicaid for individuals who are disabled, who are working, and who are between the ages of 16 and 64. If a individual, if their SSDI or their income from Social Security is under 150% of the federal poverty level, they would be able to go to work and get Medicaid in addition to their Medicare in some cases to cover them, which is wonderful work incentive. Because a lot of people need that double coverage. So this just allows them to keep their Medicaid in place along with their Medicare many times. If their income is higher than 150% of the federal poverty level, then they may have to pay a $50 annual enrollment fee to be a part of HCWD Medicaid. And if their income exceeds the 200% of the federal poverty level, they would be required to pay not only the $50 enrollment fee, but they may have to pay a monthly premium, and that would be calculated by Department of Social Services. So I said this earlier, when should you meet with the benefits counselor? When a person starts actively interviewing, actively applying for jobs, they have an ideal of how much they want to work and how much they want to earn, then that'll give us a better idea to be able to start a conversation about how that would affect the benefits. Again, if a person wants to make changes to their jobs, or if they need certain accommodations, those are things we would talk with them about also, because sometimes those accommodations on the job can also help reduce a person's countable income. If it's something, it's called a subsidy or special condition, where Social Security looks at the value of their work versus the dollar amount of the work. So if there is an established subsidy, meaning that the person's not working at 100% capacity on SSDI, Social Security can use that subsidy to help reduce a person's countable income. Next. So we do have the WIPA program. Social Security's WIPA program does have a helpline, or sometimes it's called the Ticket to Work Help Desk. This is a number where individuals that may not be quite ready to start work or applying for work, but they need some basic information. They can call the help desk, and those individuals are trained to give them that basic information about work incentives and returning to work. If that individual calls the helpline and they are ready for work, then they will forward that referral over to us to the county, the appropriate counties that we cover. And the number is there for that. This is the just our coverage area sheet. So the counties and the staff that cover those counties. Currently, there are 4 of us, 2 full-time, 2 part-time, that cover quite a few counties which are listed here. And so hopefully you'll have that as a resource. Also, the next screen talks about the other counties in North Carolina that we do not cover. Those counties are covered by Service Source, another agency. So that is their contact information along with the counties that they cover. Next. Now we're at our Q&A session. So we are open up to questions right now.
I'm going to give our panelists just a moment to get prepared to be back on camera, and then we will move right into the question and answer.
Okay. Thank you.
All right. The first one is for Regina. It says, do care managers sign up for this service? And this is referring to the Healthy Opportunities pilot.
Yes, the Healthy Opportunities pilot services will be they'll be set up by the care manager, and the referrals will be completed by the care managers through the social determinants of health and any other type of screenings or discussions that they have with members that identify needs in the area that the Opportunity pilot covers.
And then, Regina, this is for you. How long before the Healthy Opportunity pilot goes live across the state? And this was in reference to Cabarrus County.
We do not know that. We haven't gotten word on that yet. I know that is the hope that it will. Right now, this is a pilot just to see, to test how the services help members or people improve health outcomes. So right now it's just in the 2 counties, and we're not sure when it's going to expand.
Thank you. The next is just a comment saying it seems like a great program, which is highly needed, especially in Durham County. So the next question is for Miss Jacqueline and Lisa. Are hearing aids considered an impairment related work expense?
Yes. Hearing aids, the cost of hearing aids, if they're paying for it out of pocket and it's not reimbursed to them, yes, that cost could be considered a impairment related work expense.
And I would add to that, like, hearing aids are very expensive. So under the SSI, they may divide that by 12 months to give them that deduction on a monthly basis. And under the SSDI, they could divide it by 12 months as well if that person is working over SGA. If they're not working over SGA, it doesn't matter if you have an impairment work-related expense or not.
Thank you. Next question is, what advantages is the PASS account versus an ABLE account?
So
Well, with a PASS,
go ahead.
okay, I was going to say with a PASS account is for you to purchase items in order to reach a specific work goal, and that you're trying to set that aside and continue to get your full SSI check. An ABLE account First of all, your disability has to be prior to age 26 for you to be eligible for a pass account. Doesn't mean you had to get disability prior to age 26. Just the disability had to be prior to age 26. That's going to allow you to set money aside to pay for certain things that you might need to pay for. However, it doesn't protect that SSI check of you getting, if you work, your SSI check is still going to be reduced no matter what you put into your pass account. I mean, not pass account, I'm sorry, your ABLE account.
It's the able. Mhm.
Yeah.
Thank you. The next question is, at what point is there an income cutoff? Is a member at risk for losing the innovations waiver services?
So Medicaid, which the innovations waiver would be under Medicaid, most of those persons are going to be on SSI. Some of them may not be, but mostly it would be covered through that 1619B if they were working and zeroing out that check. And I think we said it takes some $1,971 to zero that check out, but they can maintain the Medicaid through 1619B until the $43,307 per year. So as long as their income is under that 43,307, they're going to be entitled to keep the Medicaid.
Beth, can I add
And
something on? That question was about the innovations waiver, right?
Which
Okay,
is
so let me just share, in addition to what Jacqueline said, if an individual is eligible for the innovations waiver, meaning that a slot is open to you, you meet eligibility for that, that is open to you. And if your income goes above the Medicaid, there's also what's called a, oh, I lost my words, Beth. What is it? It's a pay down.
spend
Spend
down.
down.
Spend down. Thank you. And so you do have the opportunity, that Medicaid is open to you because those services are available to you because you're eligible. And then you have a spend down, meaning that, if your spend down was $100 a month, you would have expenses that would typically be covered by Medicaid that you would turn in receipts for, and you would spend it down. You would spend that $100 down, and then Medicaid would then pick up from there. If that doesn't make total and complete sense, I would encourage you to talk to your care manager about that, because if you do have the innovations waiver, your care manager should be able to help you with that. So that is really a separate issue than what Jacqueline talked about with keeping your Medicaid and working. And I hope I didn't muddy the waters.
And I would also add to that too, is because if you're SSDI, as long as you have Medicaid, you're going to be on your you're going to have your waiver services. So under the SSDI, if you come off your regular Medicaid because you went to work, then you have the health coverage for workers with disability Medicaid, and that's got a high resource limit on it as well, over $30,000, and there's not a cap on earned income for the health coverage for workers with disability. There is a cap on the unearned, but not on earned. Depending on how high your income gets, you could have a premium for that Medicaid. So, I mean, we have a lot of safety nets to keep that innovation waiver in place for you.
Mm-hmm. Yeah, and not really have a spend down, right?
Correct.
Yeah.
And I'm going to pop it over to you to finish moderating the questions.
Thanks, Beth. Yeah, Beth has to head out to open up another meeting. All right, so our next question is, it's really a statement. I'd like to speak in regards to my adult son. He'll be 33 in July, when he was switched from SSI to SSDI. So Ms. Gonzalez, if you have a question, we can open up so you can talk. Okay. Terry, can you unmute Ms. Gonzalez?
Yeah, can you hear me?
Yes, we can. You're breaking up just a little
I
bit.
don't
Go ahead.
Okay, all right. I'm sorry. It happens sometimes. Yeah, I did ended up putting most of it on the chat. I mean, on the Q&A. I'm sorry. Um, he, of course, yeah. We went to the Social Security office. This is how it happened. He was on SSI, and they told him. I don't know why we went there. It was some one of those, that they call you and you have to go for the recertification or something like that, and then they said that because his dad had retired, he was eligible for SSDI. So
Mhm.
everything started, but the thing is, he still cannot. They told him that, like he can't have over $2,000 on his bank account because of the type of Medicaid he has. He's on the innovations waiver. Yeah, they pay him more. He also lives independently, so they
Mhm.
pay him more with the SSDI. He What he did, it was because there was money that was supposed to be paid, but then they sent like this big lump, like a big payment. And
Mhm.
because he had bought a car, what he did was he just paid off his car with it, because uh, he was not supposed to deposit all that money. It was too much, and it would have gone way over the $2,000. So
Right.
that's what he did. So I'm a little confused because the email I got from Carol Conway, she's with Passett. It said something like, I mean, just some things were different. Like you could have more than $2,000. That sometimes they don't give you the right information. DHHS, that the Social Security office, and all these things are so confusing, and so that's all I need to know. Thank you for letting me speak.
Sure. So he still has he's maintaining his Medicaid, correct?
That's right. He
Okay.
had the Medicaid when he was a potential, used to be called CAP, when he was a
Mhm.
potential CAP recipient, and then he
Mhm.
went into the innovations waiver. So then he got Medicare when they gave him the SSDI.
Mhm. Right.
So I
S-
don't know, he like it's the thing about always keeping those $2,000 only. You can't go. Even one time he went over for like 3 pennies, and they
mm,
stopped giving him it was when he was with the SSI. So
right.
he had to apply. It was a big mess.
Yeah. And is he working?
No,
Okay.
he's
S-
worked very little.
Okay.
He it's kind of a long story. Now he has his own little businesses that he gets involved with, working from home.
Okay.
So he
Well,
does those
okay.
things.
All right. Well, I think he's still going to have the resource limit for Medicaid purposes, because their resource limit is $2,000. But that's where we talk to individuals about doing maybe an NCABLE account where you can put some of
He has
those.
that. Yeah, he has
Yes,
that.
he has that. So if he's ever close to $2,000, it would probably be a good idea to put those extra funds into the NCABLE account. That way he can use it for something he needs, in the future, housing, healthcare, whatever it may be. But he is going to have that resource limit on the Medicaid.
And, I was gonna
Right,
say
right.
too,
Okay, that's
you
what I
can,
wanted to be.
Say
Yeah, I'm
that,
sorry.
Lisa.
Go
you,
ahead.
I was gonna say, you can also open up a special needs trust. And a special
Mhm.
needs trust, you can set money over, and that's not going to be counted as a resource, because the reason he has a resource limit is the Medicaid, not because he's getting the
Right.
adult disabled child benefit off of his parent. There is no resource limit on the SSDI. It's the Medicaid that's running that resource limit on you. So
Yeah.
you can set up both. You can have the ABLE account and put money over there, and then you can also have a special needs trust, because you don't want to use your ABLE account for to grow huge. because there are like, if something would happen to him, Medicaid is going to recoup some of their expenses out of that ABLE account. But if it's setting over into a special needs trust, they're not going to touch that.
Yeah, I hear that you could have up to I don't remember, I think up to 100,000 or something like that in the ABLE account. I don't know if I'm correct with the amount. And he does have a special needs trust fund,
Yes,
but
you
his
are.
special needs trust fund is set up with I have a life insurance policy
Mm.
that will pay off. That's how the attorney, he's that was supposed to be set up, or what he advised to do it that way. And this is an attorney who does deal with, he specializes in special needs trust funds.
Mhm.
So, Ms. Gonzalez, I really appreciate you bringing all of this to our attention. You are not alone. This is something that happens to many people as our kiddos retire, as our kiddos retire, as parents retire. I say kiddos because I have a kiddo who is 33 and a recipient of the Innovations Waiver. But what I would really like to encourage you to do is to connect with a benefits counselor. Uh, Perhaps it's Lisa, perhaps it's Jacqueline, outside of this, so you all can have a one-on-one conversation and really get into your details. We have a lot of other questions here. So does that work for you, Ms. Gonzalez?
Yes, please, if you could advise me, give me the contact, or I don't know who to contact, who's the benefits
Absolutely.
counselor.
Absolutely. We will
Thank
make sure that there are some contact information in the chat. And we'll also drop again the number for member engagement here at Partners, and we can absolutely get you connected if you don't get the right number. Okay?
Appreciate it. Appreciate it. Thanks.
Absolutely. So let me see if I can grab a few more questions and get them answered. All right, so the next person had asked about wanting to set up a meeting to discuss a particular set of circumstances. So again, same answer here. We do have a document that we're going to share with everyone that attended today and registered, and it will give you the names and contact information for a benefits counselor for every county, so that you'll know who to call. So we'll be sure to share that with you. We have a question about the ABLE account. Is there a cap on how much can be put into the ABLE account? There is. I don't know the actual number, but the ABLE account is something kind of out of the realm of our focus right now. We can certainly add also some information, a link to the ABLE account information as we respond to when we send out our follow-up email to get that information to you. Okay, so this person says they don't see Durham County on the list for work benefits.
They're on a service source. If you look at the service source, it's covered, it covers Durham County.
Okay, I'm going to put that in the chat real quick. That's service source. Okay, there's another question about recipients receiving SSDI from a parent retirement and innovations. And so I would encourage you also to reach out to your care manager. And if they can't answer your question, they should be able to connect you with someone who can regarding SSDI. And again, I would encourage you to reach out to a benefits counselor regarding that.
And just a comment, most of the people that we see have to be working or have a goal of work.
Okay.
If they're not working, they can definitely call the Ticket to Work help desk, that WIPA helpline, and get some basic information. If it's something that can't be worked out that way, we will try to assist, of course.
Okay, so thank you for sharing that, Jacqueline. If someone has a question about SSDI in general, like keeping their Medicaid and Medicare,
Mhm.
who would you recommend that they reach out to?
The helpline should be
The
able to
helpline?
provide that information.
Okay. All right. Okay, I'm moving down the questions here. So Terry, we answered the one about Durham County. You can let that one go. And I see there is a question about a care manager with Alliance that said they couldn't answer a question about SSI or SSDI. So it sounds like from Jacqueline's recommendation to call the helpline will be noted on the information we send out. And Terry, the one, Miss Gonzalez, yeah, thank you. Okay. If a person has children, does this affect their SSI?
If a person has children, not if the children are not disabled. No.
Okay. Will the recording be? Yes, we will post the recording for this session. Does each person have a dollar amount cutoff they can earn from work a month, a year without losing Medicaid? So again, in an effort of time, we did cover that earlier. And so we will be sharing the slide deck and the recording and the document that will share information on contact. If someone is receiving SSDI and they are laid off, do they keep their SSDI?
It depends on what phase they're in as far as their work, or have they completed the trial work period, or if they're in the extended period of eligibility. Definitely, if the benefit stops and they're still within those 36 months, if they were laid off at that point, their benefit would continue because they're still protected under those 36 months. If a person has worked themselves off of benefits and terminated, they have within 5 years of the termination date. If they need to get back on benefits without a new application because they're no longer able to work at the current SGA level, they can request expedited reinstatement to get back on benefits without a new application.
Wow, so much information.
It's a lot of information.
Yeah, so all of you that have questions, and I completely appreciate your questions. I would really encourage you to reach out to a benefits counselor directly if you are working, and your care manager if you have general questions. And again, if your care manager cannot connect you with who you're the information that you need, feel free to call member engagement here at Partners, and we will try to get you to the right individual to answer your questions. All right, so the questions continue to be very specific. All right, I'm going to ask one more question. We are right at the end of our time. This is the last question I can share because there are two here about being a representative payee. If someone has a representative payee for SSDI, should their work payments also be made to the representative payee for their benefit?
No. They're a representative payee simply for Social Security's purposes of helping that person manage their money.
Okay, thank you. All right. So I want to give a great big thank you to Jacqueline Moore and Lisa Oakley for sharing information about working and keeping your benefits. It's a big topic, and I really encourage you to reach out to the benefits counselors if your family member or yourself, you are working. I also want to say thank you to Regina Haynes, Program Manager for the Healthy Opportunities Program. Thank you for joining us today. You all will be hearing more about healthy opportunities through Member Cafe and other avenues as well, as it will launch on May the 1st for the pilot counties. And again, the pilot counties in our area are Burke and Rutherford. So again, thank you for sharing your time with us today. We really appreciate you, and we hope that you'll join us next month for Member Cafe. So y'all have a great afternoon.
Thank you for having us. All right.
Oh, you are welcome. Bye-bye.
All right. Take care. Bye-bye.